Good evening and welcome to your Ann Arbor District Library, and welcome again to a Friday night AI talk. Today we're going to be talking about the applications of AI in preventing epidemics, so AI versus the flu. Today we have with us our usual friends from the College of Engineering, Computer Science and Engineering Department, as well as one of our colleagues from the University of Michigan School of Medicine in, correct me if I'm wrong, infectious diseases and internal medicine. To go over a couple quick housekeeping tips. Number one, if you are in need of hearing assistive devices, there are two of them that are outside in the hallway that you entered in on the table, so if you need those. And also, as you exit this facility and then turn to the right, there are bathroom facilities there as well. There will be a time for question and answer, and we would ask you that you raise your hand and we will pass you the microphone. This is being streamed on YouTube Live and recorded for future broadcasts on our YouTube channel. And so we would ask that you ask the question into the microphone so that can be recorded for our audience listening online. And without further ado.
Alrighty, well, thank you. I assume this is on or not? No? Maybe now? Yes? No? No? Do you agree it's on? Yes? No? No?
Yeah, maybe closer.
How about now? Is it better? Okay, alrighty. Well, welcome. We are glad for some of you to have you back and for the newcomer to join us for this event. This is a series that we started, now it's 5 years. Really the goal is to engage with our local community. I feel over the years there is a lot of cool research that's happening at the University of Michigan, but we don't really talk much about that. And conversely, there is a lot that's on people's minds that we don't really get to hear. And especially in AI, yes, we cannot escape it. It's everywhere, oftentimes hyped. And I think these kind of conversations are even more so very important. I'm Rada Mihalcea. I'm a professor of computer science at the University of Michigan, where I also direct the AI lab. And on behalf of the AI lab, also the Ann Arbor District Library and our collaborating departments, we are happy to have you here for this discussion around AI and the flu. I don't think the flu season is quite here yet, fortunately. Hopefully we'll not have it this year. But it's definitely a timely conversation to have on what are some of the challenges and opportunities at the intersection between AI and epidemics. I was trying in the description that we had not to bring up pandemics, but I guess that's still fresh on our minds, right? So we've just been through a pandemic, and COVID has shown the kind of challenges it can raise on a variety of angles, both in the healthcare space, but also on a societal level, where we could have possibly benefited from the AI. So really the question that we are asking tonight is how can technologies like AI can prevent and predict epidemics and possibly also pandemics. So I'm excited to be joined by researchers who think deeply about this space, coming both from the AI angle and the epidemics angle. We have here Alex Rodriguez. So he's my colleague in the AI lab. He's an assistant professor of computer science. His research interests include problems at the intersection of machine learning, time series, multi-agent systems, uncertainty quantification, and scientific modeling. He is primarily motivated in his work by problems in public health, computational epidemiology, and community resilience. During the COVID pandemic, he worked very closely with the CDC and helped with some of the predictions and pandemic models they've been building, and probably we'll hear more about that tonight. He got a number of awards for his work, including the first place in the Facebook CMU COVID-19 challenge, and then also second place in the C3AI COVID-19 Grand Challenge, among other awards. We also have Professor Adam Loring, who's in the Department of Internal Medicine, Division of Infectious Diseases, and the Department of Macrobiology and Immunology at U of M. He studies the fundamentals of how viruses mutate and how this drives the evolution of poliovirus, influenza virus, SARS. His most recent work utilizes advanced sequences of influenza virus and the SARS specimens to understand viral spread across communities, and also understanding the vaccine effectiveness. He was also part of a project that uses AI to understand factors that contribute to viral emergence. This is some of his more recent work, and therefore you see also why he's part of this conversation. And you have Yara El-Tawil, a PhD student in the AI lab at U of M, who works on computational models for emotion recognition and mental health. So maybe not so much on viruses, but she's been instrumental in coming up with the activities that we'll do tonight, just for you to have a flavor of this space of AI and immunology. So before we get started, we already heard a few logistics from the Ann Arbor District Library, but just to share a few more. As I mentioned, Yara will be running through a couple of hands-on activities. You have a handout that you got as you walked in. We'll address various aspects of AI and epidemics in a panel-style conversation with Alex and Adam afterwards. And we'll make sure to leave some 15 minutes or so at the end for you to ask your questions. So please do keep those. Whenever you get questions, you can keep those, make a note, and there will be time at the end for that. All right, so we can get started. And Yara, please.
Hi, everyone. Can you hear me? Could we get the slides, please? Thank you. So for today's activity, you actually all will be acting as epidemiologists. And in your handout that you were given as you were walking in, you've kind of got just some information. So I want you to take a look at it and let me know which of these populations you think is having an outbreak of the flu. So, take into account all the data and make a decision. And if you look on the back, there's a QR code, or I will also post it up here, where you can actually take a look at the handout and answer the question. Let me just open the poll. So if you could look at this information and submit population A or B in the poll with your name if you'd like to be entered to win a t-shirt. And we'll maybe do a minute or two.
Can we see back the population?
Oh, yes.
You want to enter? Yeah. I also need one more.
Sure, I have an extra right here.
I don't know the answer.
The Slido code is 5572763, but also the QR code on the back should let you do that. Oh, doesn't work. Yeah, 5572763. And remember to submit your name along with your answer if you'd like to be entered in a t-shirt drawing.
I think there is a person that.
I'm sorry.
Oh, maybe she has seen some.
Are you looking for? I think we do have.
Yes, there is.
In the back. Oh, closer to the mic? Yeah,
Oh, yeah.
sounds good. I'll do that. We're just doing a little bit of question time. And it looks like people are almost done typing, so I'll give it maybe 20 more seconds if you have any final answers to submit, and then we'll move on. Okay, perfect. So actually we have, as epidemiologists, we've continued with our study, and we actually now have some new information. So we have noticed that population B, which is the town, is having a high volume of fallen leaves, which can tend to be a really common allergen for some people. So to address this, they're actually, to get rid of some of them, they're burning leaves, which is also leading to some air quality issues. And so with these allergens, they're having more sore throat, stuffy nose, respiratory symptoms. So, you can kind of notice that in your spreadsheets, they're actually buying more tissues, going to the doctor more to complain about these symptoms, and generally might be sneezing more or having more headaches or runny nose. So given that, if I can change my slide here, with the new information, we're going to do another poll. If you could also submit your name, and if you have a changed guess or the same guess, submit both, please. And we'll do another minute or two. And it's the same poll, so you don't have to scan again. Just in the same text field. Sorry, I should have clarified that. Yes, so it's the same code. You don't have to scan again. Okay, so maybe 10 more seconds if you haven't answered, put in your answer yet. Okay, very cool. So what I'm going to do next is I actually would like to randomly choose someone from the audience to tell me their answer and why they think that is their answer. So I'm just going to randomly choose a name. Let's see. Dominic, would you mind sharing what your answer was and why? Very cool.
I was mainly focusing on the fever.
Thank you. And then let's see. Angela, could you also share your answer and let us know why? Angela Hawley, if you're here.
Same answer.
Okay, thank you. If I have called your name, please see me afterwards. You've won a t-shirt also. So, for some reason when I switch back to the slides, it does not let me. Okay, there we go. So if you guessed campus, you were correct. So the sneezing and the coughing that you were seeing from the town was coming from the allergens in the air and not necessarily so much like a flu outbreak, although some of the symptoms were really similar. So you might have noticed I've been using pictures of Ann Arbor here, and this is actually loosely modeled on a actual flu outbreak that happened in 2021. So very interestingly, campus was getting this flu outbreak much earlier than everyone else. So the CDC actually came to investigate. People were really worried. But it turns out just the college students were coming and giving it all to each other, but the real flu season started when it started in the rest of Ann Arbor. But it was just interesting to see Ann Arbor in the news for an unfortunate reason. But what I was hoping that this activity shows you is giving you a way to look at how, it's a very basic setup of how some of these activities, how some of these predictions might look in real life. And maybe just to go through some other fun things that epidemiologists have looked at. You guys remember the unscented Yankee Candle reviews? So that was another study that showed that when there was a peak in unscented candle reviews, it actually corresponded a little bit to some outbreaks of COVID. So, very interesting, kind of unexpected symptom. Google also has a flu dashboard, which is really interesting, kind of goes with the searches. So if you're searching, more flu symptoms, you're going to see these peaks, and you can model different countries and filter it. I encourage you to check it out. It's pretty cool. You can actually even look into social media, and there have been studies that done that as well. And even tracking seasonal, flu purchases. So how does someone who has flu shop, So very interesting, and just kind of like a quick overview of what's out there. And I think we're going to have a really interesting discussion beyond that. Thank you so much for participating.
All right, so thanks for that. I think that was a teaser to get you thinking about some of the challenges in predicting these epidemics, and also in addressing some of them, and what is some of the information that surrounds that. So now I would like to ask some questions to our panelists, and I will start more with an introduction. I did say a few words about each of you, but it would be great to hear from you about the kind of work you do and what got you interested, especially in this space of epidemiology and intersection with AI. We can start with.
Okay. Okay, hello, my name is Alex. I'm assistant professor here at the University of Michigan in computer science, part of the AI lab as well. And I work on AI for public health. Generally, I work on multiple problems that can be motivated for public health that are AI problems, and we can make actually an impact on developing new methods that can properly address this important application. You may be asking why we need AI methods for public health in the first place, because epidemiologists have been developing also multiple different models. The motivation actually, Yara actually get a really good introduction of that, of the vast amount of data that we have in public health, of multiple facets, or multiple aspects of epidemic spread. So as you may have seen, we had this Google data, we had purchase data, and the patterns in order to identify real outbreaks are sometimes very complicated. Sometimes you may think that a simple Google trend, for example, like maybe going up, you may be thinking that actually that's a really good indicator of an outbreak. But sometimes this trend can be due to factors such as social media. For example, somebody famous has some flu or COVID, and then there is a spike in the interest of people on searching for this disease. So then that will be something that could be misleading. So therefore, we have to look into multiple aspects of the data, and AI can really help us to understand the patterns, the complex patterns that can help us to identify the real outbreaks and real predictions. So I got interested in this aspect because my PhD advisor was super interested on this and epidemics. That was one of the reasons why I wanted to work with him in the first place. So when I joined his group, this was in 2018, we were working, actually the group was working on influenza forecasting. We were submitting predictions to the CDC. 2019, I was also helping with that. And then COVID arrived. And then we quickly switched gears towards responding to COVID. And we first started with predicting influenza in terms of COVID because we didn't have any testing, as you may remember. So at the early in 2020, we didn't have any tests, so we had to rely on the influenza surveillance systems in order to identify what was happening with COVID. We were making predictions for that. then later we had some COVID tests, COVID also mortality, and we had some curves, and we also could predict this. We will be submitting this to the CDC so that they can use it for communication, for decision making. And I don't want to say that we were the only ones doing this. It was a collaborative effort across the entire US. Even international teams also were supporting this effort. So I think that is just to give you a motivation of why AI and also how I ended up working on this area.
Adam?
Yeah, so I'm Adam Loring. I'm a virologist and infectious disease physician at the University of the Medical School. My research, I'm not an epidemiologist and I'm not a computer scientist, so I don't know why I'm up here. But we've been interested in using AI, and we're getting involved in some projects that look at AI. And our interest is in how viruses evolve and using sequence data to understand patterns in the data to know how viruses are spreading and also emerging. And so the AI project that we're involved in is can you go from a viral sequence and use all the kind of information that's embedded in that as a language to understand all the different ways that that virus will interact with a given host, be it an animal or a person, and then try to understand which of the tens of thousands of viruses that are in animals are a risk to us, and be able to do a little bit more refined risk assessment, taking advantage of all the information that's out there. That's particularly exciting. Not quite predicting when a pandemic will happen, but trying to assess, where to look and how to be better prepared.
Well, thank you. And maybe we can now go a little bit deeper, both on the AI side and the virus side. So maybe Alex, if you could explain maybe in lay terms, just to be for a broad audience, like how these AI models work, especially with respect to these predictions that would be relevant for virus spread.
Yes, absolutely. So there are multiple ways of how we can develop AI models for for predicting disease spread. So what I mean disease spread is you can think of in every week we have a data point, for example, an arbor of how many cases or how many hospitalizations or mortality, depending on what disease we are looking at, happened in that specific city and that specific week, or usually in public health we look in the weeks. So every week we will have to have a new data point, so we will have a time series. So then the AI model, what it's going to be doing is capturing some patterns. We are going to have some input time series, for example, the data that Yara presented, which is Google data. Maybe we can have, if we have purchasing data, also we can use it. It is very common to also use contact patterns, and contact patterns are, for example, mobility data. You may or may not know that Google and Apple were actually making publicly available the data of mobility of people, for example, but it's on an aggregate level. So in a city, for example, they will tell you not the amount of people going, but maybe a trend of the people going to, let's say, to a park or to a recreation center or to maybe a club, something like that, right? So they will give you a trend of that, and then you could see and use that trend in order to understand what patterns could be useful for your predictions. So these AI models will take this data and then learn the patterns that are relevant and make the predictions for the future. That is what usually we want to do. Sometimes we also want predictions even for the present, because sometimes public health agencies, they don't have enough resources to get real-time data. So sometimes we just have data until 2 weeks in the past. And then we want to know what happened last week and also this week. So that is, broadly speaking, how AI do these things. And there are other methods also that in my group we have been developing and working on, which try to connect also with how epidemiologists think about this problem. So epidemiologists think usually in equations, they make assumptions, they understand how diseases spread in populations, they make simulations. And we are, in my work, we are also connecting machine learning methods with those equations or understanding of how epidemiologists work, so that we can provide also more trustworthy predictions. We can also provide answers to questions that by itself machine learning AI could not handle. So that is a big understanding of that, my work.
And so now we have on the AI side, and Adam, since you work more on the sort of the viral side, it would be interesting to hear more. What do we know now about how viruses spread? I'm also like very curious myself. You mentioned like different animals, species, and virus that come. In fact, even for COVID, I think the presumption is that it came from the animals. Like how viruses spread, and then also how do they spread across species, and what do we know now?
Sure. So yeah, it's a very different kind of modeling, but it still has a commonality in being able to aggregate and make sense of patterns in large amounts of data and different forms of data. So what the projects that we're involved in are essentially from the sequence of a genome of a virus, right? So you can look at its DNA or its RNA in some cases, and that sequence of letters that is the code for the virus can tell you what the virus's coat looks like, what its different parts that do its different jobs look like, and so that's the first level, and then you can start actually understanding the three-dimensional shapes of some of the components of a virus, and then how they fit with some of our own shapes in our cells, right? And so understanding, is the virus a good fit for working within us and our cells, and which is ultimately what it needs to do. And so it's taking the fundamental sequence data and then using these other data inputs to kind of build a richness of understanding all the different things that a virus needs to do in order to get into you and grow in you and then get on to the next person, because there's actually a lot of challenges a virus will face. And so we are interested in pulling data from all these other databases of things we already know about viruses, and then using that in an AI model to better understand which ones to watch out for.
So essentially with that, would you be able to predict, like given a
Yeah.
certain virus, whether it will flourish
Right.
in a human or it will not?
I think prediction is a dangerous word for us because it's easy to be wrong. I think we look at it more as you have this vast kind of space, this vast number of viruses out there, and somehow you need to figure out when you're going to be worried and where to direct your resources, right? And so I think a good example, the way I think about it is there's a lot of flu viruses out there and a lot of different ones in birds, and we never would have thought that there'd be a bird virus getting into a cow, and that would be our problem that we're dealing with. And so, but if you're able to understand which bird viruses are able to grow in a cow, then you can be a lot more alert to those sorts of things. And so another example are flu viruses, or a lot of them are in pigs, but there's so many different flu viruses in pigs. Which one should we be worried about? We're in contact with pigs a lot, through agriculture, and it would be helpful to not predict which one, but essentially have a rank order. Like, here are the 5 that are out there that we really need to keep an eye on, in pig lots or poultry farms, to understand, when we should get worried, when we should kind of mobilize our resources to, mitigate any spread to people.
This is super interesting to me. I mean, it's a lot of things that I haven't thought. So again, from like what Alex was saying, with AI, you would think of, okay, what's my problem so I can model it? Like, what is the problem space? Like, how many viruses are there? How dynamic it is? Like, say if you go now out there, is there a new virus that came out that you have no idea about? Like, what's the problem space really? And how much we know? Like, how many viruses have been sequenced already that are in that problem space that we can address?
So it's been estimated that there's tens of thousands, if not hundreds of thousands, of viruses in vertebrates. And so those would be the ones, we're less worried about, a virus in a plant, getting into us, but, a virus that's in particularly even a mammal, we'd be like, okay, well, that's one that, mammals are closest to us, we're part of them, and so we need to be more worried. And so to us, that's a vast space, right? You can't respond to all those threats. And so you need to be able to say, okay, these ones are the ones that, we should be looking out for. Another way I think about it is, there's a danger of always, fighting the last battle, right? Like you know what you've seen before, and so you can be like, okay, we need to worry about bird viruses in pigs, flu viruses in pigs, right? But now we've got one in a cow. We've never seen that before, and so somehow you have to be able to, broaden your space and think, with unbiased, by what you've seen before, to be able to be prepared for what could come down the road. So, for us, the space is vast, and we hope to be able to use, AI models to kind of narrow that space, to, be able to prioritize what's out there.
Interesting. It also brings to mind some conversation I had with someone working in the military space, and apparently one of the big problems there is really to think far away from what you've seen before, because
Right.
that's the problem. And this brings it's like almost like a fight against the viruses.
Yeah.
Try to go outside what you've seen before. And you brought the idea of like how AI could help. Maybe whichever examples you can bring up of successful stories where technology has been used, whether for predicting outbreaks or maybe for sequencing or maybe for, I don't know, coming up with the next vaccine, like both of you, whichever examples you can give.
Yeah. Yes. Well, yeah, there are a few examples. Let me first talk about what I have seen from other places. I have seen that people are developing algorithms, AI algorithms, in order to understand in a hospital setting how we can prevent the spread of some diseases that are usually transmitted in hospitals. So in hospitals, there is something called C. diff. Probably, are you familiar with C. diff? I think the name is
C. diff, Clostridium difficile. That's
okay,
a bacteria. Yeah.
Yeah, and the common name is
I mean, it causes diarrhea.
Diarrhea. Yes.
In hospitalized patients, often
Yes.
who receive antibiotics for other infections, and that
Yes.
makes them more sensitive.
Yes, thank you. So I am an expert on C. diff. I have a friend that he actually is also an AI expert, and he works on hospital settings. They are trying to understand how, because the C. diff, actually, this virus can be transmitted not only from person to person, but also through contact or with some things. So, for example, with the nurses, when they go to the room of a patient, they may touch some things, and then if they touch and they get contaminated, they may go to another place and another room, and then they may also contaminate it. So there are some procedures in hospitals on sanitizing, but they have to be they are insufficient in preventing this spread. So they are working on how we can develop the best of way to test, for example, places or even tests in the healthcare workers, so that then we can verify identify outbreaks before they get too big to manage. So I have seen that they are working on putting sensors. For example, do you need to require to put sensors because you want to understand the certain healthcare worker, what is the movement of that healthcare worker from which room to which room, right? And what things are touching that healthcare worker. So they are putting sensors in real hospitals. They are developing this infrastructure, and they are developing also the algorithms in order to do that. So that is one story of success, I think, that is really nice. Another one is from another friend that he has been working with HIV. HIV specifically, I think, in LA. So in that case, they wanted to identify who were the persons that were transmitting HIV across homeless people. So across homeless people is something that is very prevalent to have HIV. And they were trying to understand who were the persons that were transmitting the most, and also trying to identify how to create some campaigns to talk or to maybe intervene some people, so that then this can be the spread can be prevented, right? So there were also some efforts on that space as well. And regarding to my case, I have been working with the CDC, as I mentioned before, before and during the pandemic on making predictions. And in our models, we have found that these models that sometimes they are black box, but they can still bring value, still can identify important patterns. And there were about 30 to 35 models being supporting the CDC teams, as I said, across the US and international. And our model that was based on these machine learning AI models was among the top 5 models supporting the CDC. So that is another story of success of these models supporting real-world applications.
Can you say just a little bit more about that? Like how exactly, what do you mean by supporting? Was it like predicting when there will be an outbreak? Like how was CDC using your model?
So the CDC, what they wanted to know is what is going to be the future of the epidemic curve. So time series, you will have hospitalizations, for example, and they want to understand if it is going to go up, it's going to stay still, or maybe go down, so that they can use this information in order to prepare. So, for example, they may prepare some hospital beds, they may prepare more healthcare workers, PPE, for example. So those are the kind of information that they value. So during the pandemic, they were asking for this kind of information just for the time series predictions. But nowadays, also, they are asking for even other things. In influenza, they are asking for, we want to understand when it's going to be peaking. So an epidemic curve usually goes up, and then it reaches to a peak and then goes down, right? So they want to understand when and also how big this peak is going to be. So that is another piece of information that can be useful also for them to prepare for the epidemic season, a flu season. We don't have COVID season yet, but maybe we will have COVID season as well also.
Thank you.
Yeah, I think the way I think about it is can we get other streams of data that can augment and improve what's already out there, right? And so a project that we were involved in during the pandemic was we study sequences of viruses, and many of you may remember the alpha variant, which was kind of the first of these horrible variants that spread. And it was very interesting that we were able to, when viruses mutate, they leave a record of their changes, right? And so you can detect that in viruses from different people and kind of trace the history and the trajectory of how viruses move. If you know where those people are, then you can use that data to understand where the virus was, where it is the next day, and how those changes have linked with that. And so we were able to do a study where we had sequence data from our group and from many other groups, and we're able to merge that with flight travel data. So Alex talked about Google and Apple mobility data, but this is on a larger scale where you've got what are the patterns of flights into the U.S. because the alpha variant was first identified and caused an outbreak in the United Kingdom, and so you can then see, okay, how many international flights come into the U.S. On a daily basis, which airports do they go to, and we're able to merge that with the sequence data and where the viruses are, and we were able to show that the viruses were coming in to the cities that had the biggest flight routes from London, and then going from, and then the airports that it hit in the U.S. then are connected to other places in the U.S., and so then you can then use that to understand once it's in the U.S. where it's likely to spread. And so that was an example of merging multiple different data streams to try to get a more complete picture on how the virus is moving.
And then also, I think it goes to what I would like to ask next. So it seems like sometimes it's very challenging, right? Where to even get the data? For instance, the kind of modeling that you were talking about with flights, it's probably very specific to a certain area. Like if we were to go to a different area, it would be a different story. The same, for instance, Alex, like I'm just go into like what are some of the challenges in using technology to make these kind of predictions. You don't like
Yeah.
the word, but
Right.
like trying to help, including, for instance, transferability to other groups, or COVID. At some point, it was the beginning. Where do you even have the data to make some predictions in the future? Because you are just starting. I guess even privacy. So
Yeah.
if you can point
Yeah.
to some of the challenges that you see.
Sure. I can just, anecdotes that I know about. I mean, I think in all these models, my impression is you're only as good as the data. And if the data is not high quality, you can find yourself, kind of going off in a tangent. And then the other danger is, not being aware of changes in the data. And so an example would be Google flu, which was all the rage when it first came out in I think 2008, 2007. And it was doing what we did in the exercise, taking Google searches for cold remedies and such to try to predict flu, and it did quite well. But then it failed spectacularly in 2013. And it's since been updated. They modify it, but people have looked at that example, and what they found was that there were a few things that were weird. Like, for example, in flu season, people are doing Google searches for basketball scores, right? Because basketball happens to have, coincide with flu season, but that is an association that isn't quite reliable, and certainly wouldn't be reliable in another part of the world, right? Where they don't play basketball. And then another reason is over time people changed their search behaviors on Google. So the Google algorithm is always changing. People change how they do searches, and that was throwing off the model. And so I think it highlights the need to always be checking kind of the quality of your data inputs and what the assumptions are that are going in to the model and your interpretation of the model. And that always needs to be assessed and reassessed, I think.
Yes, that is a very, very important. We call it a distributional shifts in machine learning. So this like the distribution of the data or how the data usually is happened in the past is changing over time. And that it happens perhaps for the reasons that you mentioned, perhaps because we have different variants, we have different behavior of people also. For example, early in the pandemic, maybe most people were okay with wearing masks, but later they were changing their behavior, right? So there are multiple things that how the things can change, and that happens in all applications of AI. But I think in this one is particularly more challenging because it's sometimes very unexpected, frequent changes. In addition to that, I want to mention that also in public health we have sort of a poor data quality problem. There are multiple aspects of this. Let me put you some examples. During the pandemic, the definition of sometimes some data was different from state to state. Some states, for example, they were recording the deaths, the day of the deaths when it was certificated by some legal person. In other ones were, and that certification can happen actually a few days after. And it depends on how busy the people that are processing these certificates are going to be, right? So it can take from 1 to several days. And in other states, they were actually recording the day of the death. So if you see these things and differences, and you just blindly use a model for both states, you're going to have problems. You're going to have, especially when you want to predict also or try to understand when things are going to happen, when things are going to start to pick up or go down. This can be something that can prevent us from doing this effectively. Another aspect of this is how data is being collected also. In one place, the data is collected from certain types of hospitals. For example, in Michigan, normally we have a uniform sample of hospitals. But in other states like Texas, for example, the data is coming mostly from pediatric hospitals. So when you look into influenza, for example, you will see that across the entire US, we have certain level of influenza, but in Texas, we have a higher level. And the reason is because pediatric hospitals deal with more influenza cases because kids, they are more prone to this disease and also to get more severe than adults in the middle age, for example, right? So that is another issue. Also, we studied another issue that is called data revisions, that perhaps the CDC can give you some data, public health agencies can give you data today that is going to be revised later. Let's say that they tell you there was 100 hospitalizations today, but actually next week they found out that actually there was 150 because they received more records. More hospitals sent, and then there was actually 200 and so on, right? And then if you want to make predictions on real time today, then your models are going to be misled by this process if you don't properly consider this. So there are multiple challenges. These are just some examples of that.
Well, thank you. And I guess for whoever is in the room who has an interest in this space, there is plenty of problems to solve. And I guess to Adam's point, it's also unknown problems, right? So we can imagine only what we can imagine, but probably we'll see other things in the future that will require new solutions. So I'm at my last question, so please prepare your questions. My last question to the panelists is, looking into the future, what do you see as the most promising innovation that we would expect from technology? So if you can, each of you pick one that you think like, well, if we could do that, it would be like awesome, impactful.
Yeah, one thought I have is perhaps we can use, as we said, there are some multiple changes, possible changes. Can we use AI in order to help us to maybe not foresee all of them, but at least some of them, right? So we have some blind spots as humans, right? We have some background, some expertise. Can AI help us to come out with those, or maybe discover those blind spots, so that then we can prepare also for those kind of scenarios? Early in the pandemic, just give me a second. Early in the pandemic, we saw that the scientific community was not ready because we didn't know much about what will happen. And I wonder if we had an AI system that could tell us, you may want to consider this. Your model is considering right now they are making this assumption. What if this assumption can be challenged? Perhaps you remove this assumption or you modify it in some way, and then now the story or the prediction will be very different. And then we can have a variety of views on the problem instead of having a more bias that is more according to the traditional expertise of the scientific community at that moment on time. So I think that is one possible application of how AI could make an impact. That's my thought. And maybe we can have your question in a moment. Yes, thank you.
Yeah, I think about two areas. One is, along lines of our interests, right? I talked about flu viruses and the risk of, a new novel virus coming from an animal. And, the way we do assessments now, the way the CDC and other agencies is essentially get, consensus opinion from experts, right? And, there's a score sheet that they say, is this virus risky or not, blah, 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 and they kind of reach a consensus and they come up with a score. And it feels very arbitrary, and so it would be nice to have a system that was, built on more data streams and just, self-proclaimed experts, right? Where you could, get more inputs, assuming they're reliable. The other area that I think is a little distant from what we're talking about today is understanding the shapes of proteins and understanding how that works, both for designing better ways of making vaccines that stimulate our immune system in a more reliable way. So there's a lot of research in that area that involves AI models. Also looking at drug discovery. There's a lot of work in AI to understand how to design a drug that will better fit into our proteins and do what we want them to do without side effects. And so there's a lot of use of large amounts of data to improve that process, which is largely kind of been a brute force way of doing things until relatively recently. So that's pretty exciting.
Yeah, and I think we could benefit from that because we see sometimes vaccines are effective, sometimes they are not. So what you're just bringing up, having some kind of help with those predictions, I don't know,
Right.
for lack of a better word. All right, so we can take some questions from the audience. I think the request is if you could please just raise your hand so we could give you a microphone.
Hello. So the question that I wanted to ask is, since AI right now, or like these LLMs, don't technically reason, and all of the data that it's currently being trained on has some level of pollution somewhere, and you guys were talking about like moving around biases. So like what's your kind of like approach to that? Because I've been struggling with kind of creating like a surefire methodology for that to work, because like between models it's like changing. So I was wondering like what your thoughts on that were.
One of you, whoever wants to pick it up.
I think you're more. You're more
Okay, then Alex.
Yeah. Well, in general, how to verify that the data is going to be correct or has the right quality is a challenge in general in many applications. So I think you need some expertise first of all. You need to maybe work, and then I think that is a space where interdisciplinary work can happen. So when you can meet with somebody and try to understand the problem really, and then understand what is what are relevant things that you should be modeling. In the case of LLMs, I guess there are some identifying, for example, maybe the right data set, for example. Some data sets that might be some more polluted than others. Perhaps Rada can tell more about that. In public health, is identifying what I commented, right? For example, the data quality disparities across states, for example.
I'll just echo briefly, as a non-expert in the models, that my job in some of these projects is to kind of be the gut check and say, here's the model output. It's like, well, that makes no sense, right? Like, so I think, echoing what Alex said about, checking and checking your assumptions, checking, your data, I think is, with people who are, not in the field, but, know the area, I think is an important step.
Thank you.
My question is for Alex. I'm just curious if you could talk a little bit about if you train and build the models for the time series predictions, or if you use tools like Time GPT.
Oh, yeah. Regarding to the use of tools of GPT, we could use actually. I haven't used it in my work, but I have seen others using it for. I'm not sure about for epidemics, but maybe in recent 6 months or to 8 months, there has been some attempts on using GPT and combining and trying to use it for time series predictions. So I can tell you that there are some work, but it is not yet widespread.
Are the existing AI models capable of, if a virus crops up, let's say in Pakistan, to give its direction and speed that it'll spread and possibly when it might hit the United States?
No. But I don't think it's out of reach, right? I think we're moving in that direction. We're not there yet, but the challenge is right as you highlight time, right? Like if we were in China in December of 2019, would we have the data fast enough, to act? And that's always the key. But we're not there. But I suspect we're moving towards it quicker than you'd think.
And I think it would be hard to disentangle the two of you, but I guess the natural next question would be is it primarily because of what we know about, for instance, viruses and what they spread? So is it the knowledge and the data, or is it more about the models not being capable enough? And again, I don't know that quick gut reactions, like is it the model trouble or the
I think
data
it's
problem?
both. I think the data collection is key in many cases. For example, I know that there's a project led by Microsoft Research that they are trying to put sensors for mosquitoes. So then they can put, if, for example, in Africa, they put like a big device that will capture mosquitoes, and then will test, basically test if the mosquitoes, they have some virus, and they will alert, basically provide this alert where there is a bunch of mosquitoes that they have this virus. But currently that is just a test, right? There are no such a devices in the world, but it is something that we, little by little, we are going to be having more and more, right? This is data that is not available. Otherwise, what we are going to be seeing is people getting sick, and it perhaps it's going to be already late because there is an outbreak already in the community, right? So one aspect is the data. Another aspect, as you refer well, is the models. Models, because these are novel emerging threats. Therefore, we don't have data for that, and our models may misbehave. So it depends on what data that you are using. Also, I think this is a two-side problem.
So maybe we can take one more question. I saw that.
Oh.
Okay, over there.
Thanks a lot for the
And then afterwards, for whoever has more questions, you can come by and speak with them.
yeah, thanks a lot for the great talk. I learned a lot for the pandemic prediction and also the virus sequence prediction. I have two questions. The first one is, do we have open data or open challenges, for instance, like on platforms like Kaggle, to dealing with the, for instance, like the pandemic prediction, or is it just like a lab-to-lab or lab-based research? And my second question is for Alex. You mentioned that some of the recent papers use time GPT for the prediction, and I wonder whether there's like de facto models you guys use, for instance, like linear regression or logistic regression to do the sequence prediction stuff. Thank you.
I mean, certainly there's open data, at least in my field. There's been a large push over the last several years, and so there's a lot of open data out there. Of course, one thing we didn't talk about is privacy, and so there's always that to ensure that. In terms of my impression, in my space is that there's open kind of sharing of the models. People have their code, have their people are doing it individually, but I haven't seen a lot of here's all the data out there, people posting their models openly, but there's certainly sharing of approaches in code, maybe not completely open. I don't know.
Yes. I definitely there is the models are not fully open. Some of those models were developed, so especially the simulation models, they develop over multiple years, and the groups that they develop those models, they don't want to share them because it's a lot of work. But there are other models that are shared. The models that we develop, usually they are not developed over the years, but they usually they are shared, and the data sets are also thanks to efforts by individuals, and also nowadays by the CDC. Also, we are making the data more publicly available. There are some places where you can find data actually for multiple outbreaks across the last maybe 20 years, for example. So there are some data sets on that. And regarding to your second question, regarding to the time LLM, right? So we use not timing LLM, but we use maybe some more some others of methods based on recurrent neural networks or transformers. So similar neural network architecture than the LLM, but trained with much less data and also for more specialized in time series.
All right. So with that, I hope you learned something new. I definitely did. I don't know that you necessarily feel more prepared for the upcoming flu season, but hopefully we'll be more prepared for the future ones with the help of technology. Many thanks to our panelists, Alex and Adam. Also, many thanks to the Ann Arbor District Library for hosting us. To all of you for the questions and also for the attention. To Yara for the interactive activity, and also behind the scenes, Christina and Aura have been helping to organize this event. We'll have some future events in next year. But until then, happy holidays and thanks for being here tonight.